Hey YouTube, this is Catching Up with Crystal. Can you keep up with me? Because you never know where I'm going to be. And today I'm coming to you from the clinic, and we are 2 days before Thanksgiving. I wanted to pop in real quick to make a video about seasonal affective disorder. I'm not sure if you guys are aware of it. Where I'm at today, it's very cloudy, gloomy, rainy, and gray outside. I wanted to pop in and share with you that sometimes people are really affected by the seasons. When it's sunny outside, the sun shines on us, it gives us vitamin D. Light has been shown to improve depression and our mood. But when it's cold and gloomy and gray like it is today, it can cause us to have depression. On top of that, it's the holidays, and there are people who don't have families or friends or places to go, and they'll be alone through the holiday season, and that as well can cause depression. So let me tell you about seasonal affective disorder. It's also called SAD. S-A-D is the acronym. It's a type of depression that is related to the changes in the seasons. So we've just gone from summer to gloomier fall, winter. SAD begins and ends about the same time every year, so you may notice that you're feeling sad about the same time every year, which is not unusual. Most of the people who have SAD, their symptoms will start in the fall and they'll last all winter, and you'll feel drained and moody and no energy. There is a treatment for it, which is light therapy, medications, or counseling. Light therapy is exposure to the sun. So say if you went from, Boston or New York where it's cloudy and gloomy to Jamaica for a month, your seasonal depression would go away because you have exposure to the light. There is artificial lights that can be delivered to your home, or you can go to a tanning booth, or just keep the lights bright, and that does help with seasonal depression. Medications like antidepressants are helpful, and also counseling to talk through your issues. Do not ignore those feelings that you're having, and don't blow them off just saying, oh, I've got the winter blues, or I'm in a funk. Just make sure that you're taking steps so that this depression doesn't hold on to you and last throughout the years. What are the signs and symptoms of seasonal depression? You might feel sad or depressed most of the day, almost every single day. You might lose interest in activities that you used to enjoy. You might have low energy, finding it difficult to even get up out the bed. You might have issues with sleeping, either falling asleep, staying asleep, waking up early. You might change the way you eat. You might eat more or eat less. You might gain weight or lose weight. You might feel agitated for no reason. You don't know why. You might feel sluggish, like you just don't have the energy, low mood, low energy. You might have difficulty concentrating and focusing on your work, or become forgetful. Walk into the room, forget what you were there for. Can't sit down and do your work. The simplest tasks are difficult. You might feel hopeless, worthless, or guilty about certain situations in your life. Maybe you feel guilty because you didn't clean your house, but that's okay, because sometimes not cleaning your house is a symptom of depression. You don't have the energy or the desire. You might have thoughts of suicide, or feeling like you want to die, or thinking about death a lot. If you're having those thoughts and you're developing a plan, you need emergent help. You really need to talk to somebody right away. You might also not want to be bothered with friends and family. You might withdraw socially. You don't want to be around others. You don't have the energy for it. It takes a lot of energy to socialize. You might start to develop problems at school or work. You might get confrontational. People might say you're moody, you're difficult to work with, or your work is suffering because you can't focus and concentrate on it. And you might notice that you if you maybe were a glass of wine a night or a glass once a week or whatever, you might notice that you are increasing your use of alcohol. If you had a history of drugs, you might relapse. What are the causes of social affective disorder, also known as SAD? Sometimes it could be your circadian rhythm, and that is our clock. It's an internal clock, and when there's a reduced level of sunlight like we have in the fall and the winter, it disrupts our body's internal clock. Also, a drop in serotonin. Serotonin is a hormone in our brain. It's a chemical. It's called a neurotransmitter, and it affects our mood. That's why when we take antidepressants, they replace the serotonin where we're missing serotonin. When there's not a lot of sunlight, serotonin can decrease in our brains, and it can cause us to suffer from depression, as well as vitamin D levels drop, which can also cause us to feel lack of energy and suffer from depression. Our melatonin levels are also affected by the fall and winter and gray months. And melatonin plays a role. As you know, you can go to the store and buy over-the-counter melatonin, and it'll help us sleep. But in the wintertime, when we don't have accurate melatonin levels, then our sleep patterns and moods change. So, what do you think the risk factors are for developing seasonal affective disorder, or SAD? What do you think that is, that depression that we get in the fall and winter? Family history. If there's somebody in your family who suffers from it, it's an increased possibility that you could suffer for it. Having a history of major depression or bipolar, symptoms of depression, if you already have those, depression or bipolar disorder, sometimes in the fall and the winter they get worse. And did you know the further you live away from the equator, the more common depression is, because we're further away from the sun? So when do you think it's time to go see your healthcare provider? Go see them anytime you feel like it. Anytime you notice that there's a change. Anytime you're feeling sad for more than 2 weeks, you're clinically depressed. If you've lost your appetite, lack of motivation to socialize with your friends, changes in your weight or your appetite, changes in your just normal pattern, thoughts of suicide or death, go see your healthcare provider. All right, guys, this has been Catching Up with Crystal. You have caught up with me at the clinic, and I wanted to pop in because we're right before Thanksgiving and people are now in the season of increased depression. Please like and subscribe, hit that bell notification so you know when new content is posted. I hope you guys have an awesome Thanksgiving. Have a happy holiday. Even if you're spending it by yourself, know that you are not alone. Go volunteer. There's going to be a lot of homeless soup kitchens open who are looking for volunteers to help feed the homeless. And I always say, when you want to feel better about yourself, if you help somebody else, you're going to make them feel good, and you're going to feel good too. If nobody told you today I love you, enjoy your holiday, and I'll see you in the next video. Bye, guys.